We are happy to welcome to the show from the Walton Insurance Group, Account Executive, Medicare Professional, Adriane Earl. Welcome back.
Thank you.
Nice to have you here.
Glad to be back.
Yeah. Medicare Professional, did you have to go to like 8 years of college for that?
Feels like it.
It can be so complicated and confusing.
Oh, so complicated, so confusing, so many things to learn, and they're always changing. I mean, every year they come out with, new formularies, new changes, all of the things. So it really is like a Medicare maze.
Well, thank you for staying on top of it, so we really don't have to worry about it.
Right.
You do the heavy lifting, and it's because it's the government, right?
Right.
Yeah.
We'll say no more about that.
It's the government, yeah. All right, so one of the things that's always baffled me is that the calendar, you can only do certain things at a certain time of the year. Mm-hmm. It is what it is, right?
Yes.
And are we at that point?
Yes. October 15th starts the annual open enrollment period. So it's October 15th to December 7th. And as Paula in our office calls it, it's kind of like a condensed tax season. We have to meet all of our beneficiaries' needs in a short amount of time. So it's very important that we meet with all of our beneficiaries to ensure that they're in the right plan. I mean, everybody looks at their homeowner's insurance, their car insurance every year to look at renewals, look at prices, what's changed, what can be added, and I suggest the same thing for people on Medicare.
I agree, because when someone approaches the age of 65, you will get inundated with sales pitches in the mail and on the phone.
Yep.
It's really not fair.
No, it's really not.
No,
because people get so confused. I had somebody call me the other day. She says, I got something in the mail and it says they're just going to sign me up. Well, it's really not what it was, but I could see where someone who maybe wasn't, savvy with the lingo could get confused and sign up for something that they didn't really want.
Well, those that are my age and older, they know a bit about it, but even you can't know it all because it's changing.
Yes, ever changing.
Every year.
Yep.
All right, first for those that might not be familiar, Medicare and Medicaid, they're two different things.
Yes.
What are they?
So Medicare is for anybody over 65 or somebody who's disabled. Medicaid is for lower income people who have, meet a certain threshold.
All right, open enrollment for Medicare right now. And do people have to make a change, make a determination, re-enroll every year?
Well, they don't have to re-enroll, and they don't have to make a change. But if your prescriptions are changing, maybe you have a new medical diagnosis, something along those lines, the plan that you were in last year may not be the most comprehensive for you this year. So that's why it's important, because it is so specific. What's good for you may not be good for your wife, may not be good for your neighbor. So it comes down to your doctors, your hospital preference, the prescription drugs you're on, or really what kind of drives where you're going to go as far as cost. So it really is important to look at it every year and decide, am I in the right plan? And a lot of times they're in the right plan. You don't have to make any changes, and you can just move on.
And there are some things that might influence your decision that happen to you health-wise.
Correct.
Like maybe your eye vision is fine, but your doctor's saying, in a couple of years you might need cataract surgery.
Yep.
Then you would consider having some supplement to pay for something like that.
Exactly. Yep. You have a Medicare supplement option or a Medicare Advantage option, and two completely different options, and some are good for others, whereas you may be steered the other way because of the diagnosis or the drugs you're on. Medicare Advantage may not be a good fit for you.
Is there such thing as like a Cadillac plan where you just go and say, hey, I need the best, I want it all?
Yes. Medicare supplement, Plan G typically. Most everything's covered. You don't have to worry. There's no network. You can go anywhere that Medicare is accepted. 97% of hospitals in the United States participate with Medicare, so you wouldn't have to worry about it. Whereas Medicare Advantage is more like an employer-sponsored plan where you have a network and you have to have a primary care physician. So that can also be a driver as what you choose. If you're traveling, if you're going, to Florida or Arizona for the winter, you're probably going to want a Medicare supplement policy, assuming you can afford it. because then you don't have to worry about the network.
Yeah, and those that don't accept Medicare, it's going to be some like a Beverly Hills hotel
Sure.
or a hospital. That's where people don't worry about the money.
Right.
Yeah.
And at that point, money doesn't matter. So,
Yeah. So having universal availability, and it's cheaper than, I mean, if you were to go out and buy health insurance at age 60,
Yeah.
you're going to pay a heck of a lot more than any of the extras.
Oh, yeah.
Yeah.
Absolutely. Yeah. I mean, you know, you look at the marketplace and you think you're going to get a good deal, and a lot of times it's nowhere near as comprehensive as a Medicare supplement or Advantage plan would be.
So people that would, and the things like co-pays or what's deductibles? Those, they're typically, they're very minimal, right?
For the most part, they definitely are trying to make the plans so people can afford them, you know, as far as Medicare Advantage and things like that. They also offer a lot of extra benefits. Medicare Advantage, you know, offers maybe dental, vision, hearing benefits, over-the-counter benefits. A lot of these companies for 2024 are giving $150 a quarter for healthy living benefits because, you know, getting healthy fruits and vegetables are important. And so they're kind of seeing that we need to add more to these plans to make sure that they're comprehensive for the beneficiaries.
Yeah. And the way it should be, where vision, dental, hearing, and every other physical and mental aspect of your health should be included as one thing, but it's not.
Yeah, and they really are doing extra for the mental health. I think they know kind of in the world we live in now that that's very important to people. So there are a lot of low-cost options for the mental health services, if not $0.
Yeah, so really the best, my advice, and I'm not, you know, a professional, but I'm a professional consumer, and that is get an expert and have someone, because you will sit down with people and walk them through all this.
Oh, absolutely.
Yeah.
So, you know, first I meet on the phone or via email, gather the information that I need, put together a quote package for them. I prefer to meet in person just because there is so much to go over. Meet with them, and really it's just very consultative. You know, I don't ever want to feel like I'm selling them something that they don't want. I meet with a lot of people, I show them what they have, and sometimes they don't buy anything. But you know what? I feel good that I gave them a good consultation, and what I'm suggesting is going to be the best for them.
Great. So other things that happen this time of year, and we are in a period, I think maybe it even ended the Medicaid redetermination.
Yep. So there is some Medicaid redetermination. So that's going to cause a lot of people to lose their Medicaid benefits. So that means they have a choice to make. Maybe they are Medicare eligible. You can give me a call. If they're not Medicare eligible, we may be able to get them into a marketplace plan with some tax subsidies. So there are options, but just to be on the lookout that for a letter in the mail about Medicaid redetermination.
And do something, because I understand that a lot of people lost their benefits simply because they didn't respond to the...
Exactly. And once again, it's the government. So, you know, they send you something in the mail. If you don't answer it within a certain time, they don't really care.
Yeah.
So it is important to do something right away.
And what are DSNP products?
So DSNP products are people who are Medicaid and Medicare eligible. Absolutely fantastic plans. They're basically $0 out of the beneficiary's pocket. All copays are covered, over-the-counter benefits, just a plethora of options for them. So definitely somebody who would be eligible should give me a call.
And there potentially are people that are Medicaid eligible, they don't even know it. They've never been in the system.
Yep.
And you can help
And
people.
I can help determine that for them too. Yep, I have a tool that helps me look.
There's a lot of people that they're just missing out because they just haven't.
I just haven't made the phone call.
So October 15th is when the open enrollment starts and goes till?
December 7th.
Okay. So sometime
in there. Yeah. And slots are filling up. So.
Well, they can meet with you now.
Well, they can meet with me now, but 2024 plans are not available yet.
Oh, we don't even know.
No, we don't even know. No. So that's hard. So they come out the 1st of October, and then it's like a race to December 7th, and then it will be Christmas.
Yeah. And there's things that have changed. I think about the government did freeze some prescription drug prices like insulin just this past year.
Yes.
So there's some things that happen every year that could impact how much it's going to cost you.
Yes, and the annual notice of changes are starting to come out for some of those Part D plans and the Medicare plans. So make sure that you check your mail, that you don't just throw it away. It's going to say annual notice of change right on the front. So you should take a look at that and see what your plan's going to do. Could be going up, it could be going down.
Great.
Yeah.
Well, thanks for coming in.
Absolutely, thanks for having me.
Yeah, thanks for all the help you provide our community. The Medicare professional, one of the Medicare professionals and account executive at the Walton Insurance Group, Adriane Earl. Next